Good afternoon, everyone. My name is Holly Huang, and I am a Community Outreach Coordinator with the Howard County Office of Human Rights and Equity. And I am so excited to be able to welcome you all to our virtual program today, Shattering the Stigma, a panel discussion in recognition of National Minority Mental Health Awareness Month in July. And so before we get started, I do want to give a brief introduction to our office and the work that we do. And so the Howard County Office of Human Rights and Equity is an entity of Howard County government that seeks to eradicate discrimination, increase equal opportunity, and protect and promote the human rights of people here in Howard County. And our office houses 3 different units to do this work. We have our investigative unit, our equity and restorative practices unit, and our community outreach unit. And so first, the investigative unit does exactly what the name says. They investigate and process complaints of unlawful discrimination in Howard County. The investigative unit also enforces the Howard County Human Rights Code, and they conduct public hearings on issues affecting the protection and promotion of human rights here in the county. Next, we also have the Equity and Restorative Practices Unit, which uses an equity-centered lens to incorporate concepts of equity into Howard County government service delivery, decision-making, and distribution of resources. They work to ensure a shared understanding across Howard County government of racial equity and social justice by supporting change among government departments and staff through equitable practices and policies. And finally, the Community Outreach Unit, which is the unit that I am a part of, is responsible for increasing the presence of the office throughout the community. And we accomplish this by putting forward programs just like this one, and by providing trainings and workshops, listening sessions, and different events to government agencies, organizations, and community members around racial equity, social justice, and human rights and relations. And so today, we at the Office of Human Rights and Equity are very excited to introduce our 3 panelists for today, beginning with Denise Giuliano. So Denise Giuliano is the Executive Director of the National Alliance on Mental Illness of Howard County, also known as NAMI Howard County. And this is a position that she has held since 2018. Prior to coming to NAMI Howard County, Denise did extensive volunteer work for the Community Action Council's Head Start program and for the Howard County Public School System. Her professional background is rooted in public policy, having worked on Capitol Hill for 6 years and as an education and healthcare lobbyist for 2 years prior to raising a family. The most meaningful part of her role as executive director is helping individuals and families get connected to mental health resources and support so that they can understand that they are not alone in their struggles. Thank you for joining us, Denise. Next, we have Dr. Razia Kosi. Razia is an adjunct professor in the School of Education at Johns Hopkins University, and she is the coordinator of culturally responsive practices and anti-racism development for the Howard County Public School System. Her work focuses on cultural proficiency, equity, inclusion, and social justice, and her recent scholarship includes a chapter in counseling and psychotherapy for South Asian Americans, titled Considerations for South Asian Parenting. Additionally, she leads policy change at the state and local level for education equity. Dr. Kosi is also a mental health professional serving on executive boards for Asian American and Pacific Islander communities, and she is a co-founder and current president of the Asian American Educators of Howard County. Her awards include the Society of Excellence for Doctor of Education and the Edward F. Pajak Award from Johns Hopkins University. And finally, we have Sandra Price, who is a community educator and volunteer program manager with HopeWorks of Howard County, where she provides educational and self-care workshops for adults, particularly long-term survivors of abuse and parents, and professionals. Ms. Price is very active in her community as a volunteer, certified facilitator for Howard County's Getting Ahead program, entrepreneur, demonstrating her dedication to serving marginalized populations. She attended Howard Community College as a student in business administration, and she also attended Towson University's project management professional program. She has more than 20 years of nonprofit experience, has provided technical assistance to community programs, and she has administered scholarship programs for youth with disabilities. So Denise, and Laura, it's so nice to have you all join us this afternoon for this panel discussion. And to kind of start off our program today, I actually want to come to Denise and ask if you could give us a brief introduction about today's event, and kind of the background of why July is recognized as B.B. Moore Campbell National Minority Mental Health Awareness Month.
Sure. Thank you, Holly. Thanks so much for having me. And it's really a pleasure to be here with Sandra and Razia today to discuss minority mental health awareness. So B.B. Moore Campbell was an author and a trailblazer. She used the words in her books, including The 72-Hour Hold and Sometimes My Mommy Gets Angry, to address the profound impact of racism, mental health, and the enduring strength of culture, community, and connections. At NAMI, we are proud to call her one of our own. She was a volunteer in California, and she co-founded the NAMI Urban Los Angeles affiliate. And she became a national change agent whose enduring work revolutionized the way we approach mental health in underserved communities. In 2008, 2 years after she sadly passed away from cancer, the United States Congress designated the month of July as B.B. Moore Campbell National Minority Mental Health Awareness Month to honor all of her contributions.
Okay, thank you so much for sharing that history, because I think some people might hear the designation of July as National Minority Mental Health Awareness Month and wonder why this designation for a month might be important or necessary. And so this will kind of bring us into our first question. And I know we'll get into the details in a bit later into the discussion, but for question one, would you all mind sharing briefly about why it's important to not just raise general awareness of mental health, but to specifically recognize and raise awareness of the mental health struggles of minority communities, definitely based on your experiences in public health, education, and working for different nonprofits. And Sandra, we can start.
Okay, all right, I'll start. So I'll use BIPOC for short instead of minority mental health. But so BIPOC individuals experience mental health disparities due to various factors, including historic trauma, intergenerational trauma, and ongoing today still systemic racism. And according to the U.S. Surgeon General in 2021, Black children under 13 are almost twice as likely to die by suicide than their white peers. So again, a very serious issue. Nearly half of American adults still believe mental health treatment is a sign of weakness, particularly in BIPOC communities, and only 27% have ever even tried therapy. The intersection of trauma and the higher risk of experiencing mental and physical health problems exist, particularly for survivors of violence. So that's it. Thank you.
Hi. So thank you for having me. One of the reasons I think this is really important, almost like over 20 years ago, I started a group called CHI, Counselors Helping South Asians and Indians, in order to address the stigma and understanding about mental health and wellness. And so in trying to do this work to just bridge this, one of the things that came up was that the way that we approach mental health in this country is from a Eurocentric perspective. And so the way that it's done does not bring in many beliefs that are within cultures, and people who may go to treat, and myself included, because I was trained in a Western model, I might not have approached it from a cultural humility model, right? Like in terms of really understanding. So even in learning about how to approach this work, I think it's important for us to unlearn and learn, because of the way systemic racism works, because of certain ideas of like what is right and what is wrong. And so when we approach it with understanding how people approach mental health, what are some words that are used within the culture, not just words that are not English, but even words within the communities that are already in this country and already familiar with this language. And I think those type of things help us raise an awareness as to how do we do this in an approach that respects the community, brings a way of holistically supporting the person, because a lot of ways that we approach mental health is like cutting them off. right? There are certain ways that we cut people off because of the illness approach versus a holistic approach. So I think that those are some of the reasons why it's really important. And every community who's of the global majority, but minoritized in this country, as is experiencing things differently. So there might be some cultural ties that are familiar. So I work a lot with AAPI communities, Asian American Pacific Islanders, but it might be certain pieces that are woven, yet it's very different according to every different community. So that's why I believe it's really important. And also just myself being raised in this country, I identify as South Asian, South Indian, so these are some things I have also experienced and in working with the different people have tried to help bridge.
Well, I agree with all of that's been said so far. I think it's pretty clear that there really is a mental health crisis in this country, and minority communities are hit the hardest. They just are. And I think to go along with what Razia was saying, that really when it comes down to it, we all just want somebody who understands us and our unique circumstances and challenges, especially when we're talking about something as personal as mental health. So when minority communities, when there aren't enough providers for them to speak with someone who really understands their culture and their unique needs, it's a real problem. So I think, this month is really an opportunity to highlight those disparities, and try to do better as a country.
Okay, thank you everyone so much for sharing. I think in this way we can really understand that it's an issue of equity and recognizing these very specific mental health struggles of racial and ethnic minorities. And so this is a really great segue into our second question, where I would love for all of you to kind of share some of these unique challenges and struggles that these communities face. And to that end, how can we equitably support these communities that are facing mental health challenges? And so this time we can start with Razia.
Thank you. And if you can share some of the slides, I just want to share, I'm a visual learner, so I'd like to have a little information up so people can follow along. So if you can go ahead and share the slides. I'm going to talk a little bit about AAPI mental health and just share a little bit of facts and statistics. And so while that's coming up, we can go to the second slide. And that just in general, when we're talking about the AAPI community, that is almost 7.2% of the population in the US. And it's also important to recognize it's the fastest growing population because it rose by 72% from 2000 to 2015. So that's the national. But looking at even in our school system, AAPI students, again, Asian American Pacific Islander, comprise 23.4% of our student population. So if we have that amount in our students, then in the community with the families and community, it's much larger. So that's why I'm looking down to looking at AAPI. If we can go to the next slide. So this is a large group, very large group. But when we're talking about it, there are some numbers that are larger within this community. So often it is many groups and languages and ethnicities and cultures grouped in together. So we're talking about Chinese, Indian, South Indian, Filipino, Korean, and then this, I hate the term other, but it's including people from Vietnam, Japanese, specifically here also people from Myanmar, so Chin population, as well as Pakistan in Howard County itself. We can go to the next slide. And it includes these other groups as well. So Bangladeshi, Bhutanese, Cambodian, Chinese, Hmong, Japanese, Malaysian, Laotian, Sri Lankan, Nepalese. So we're talking over 2,300 languages. It's close to 50 dominant languages because some of them have roots in other languages. And it is a large variety and multiple cultural and religious groups. So it's a very broad group that we're talking about. So again, when we're working within communities, we need to really get a deeper understanding of who are the people here, what's important to this group, and down to the individual, and what's salient in terms of what's going to be supporting their mental health. So just wanted to give an idea of how broad it is. If we can go to the next slide. So looking at this information right here, the mental health concerns, is from the American Psychiatric Association. So here's some facts that came up. That 2.7 million actually report issues of mental health and substance abuse. It's lower than the non-Hispanic white. However, again, drilling down to the data, in Hawaiian communities, it is at the same rate as white, a non-Hispanic white. Another thing, suicide is another thing to look at. The leading cause of death for Asian American youth is from the ages 15 to 24 is suicide, and this was from data in 2017. So while that's the highest cause of death for youth, it is still half the suicide rate of non-Hispanic white youth. So we still need to look at, okay, what is happening? Why is there more completion of the death by suicide? So we need to look at that as well. And then this also looking at different groups, and we're specifically talking about refugees and trauma. Southeast Asian refugees are least likely to receive the diagnosis and support for PTSD. However, when they were surveyed and researched, they found that 70% of Southeast Asians were diagnosed with PTSD. So they're underdiagnosed because we're not asking the questions in order for them to receive the support. So again, this is broader. National data, and now I want to share some information. In HCPSS, we did do, this was through the Asian American Advisory Committee, did a survey with about, I think we had about 72 respondents who were both middle and high school. So we asked, it was a well-being survey. And so we asked them, on a scale of 1 to 10, what's your stress level? And we had 73.6% of the students say that their stress level was a 7 and above, and only 13.9 rating it lower than a 3. So the students were saying that they are experiencing higher stress levels, and the contributors to that stress are schoolwork, and homework. Which, okay, so that was good information for us to understand in terms of where the students experiencing their stress. What was very interesting is also like when we asked, like, where do you go to? Who do you trust? 44% said parents and families. And I said it was interesting because there's sometimes maybe the perception that in terms of mental health, that this is a taboo within communities, AAPI communities, but the kids are still trusting their families and caregivers first and wanting to go to them. 26% go to friends. 18% to families and teachers. Only 7% go to therapists. So this was another interesting dynamic to look at. Are the kids going and saying they trust and need this support, but only a smaller amount are going to the point of having a therapist? So it's just another thing to us to continue to ponder and understand. What is it? Are there things that are more serious that only then do they go? Are they getting the supports in other ways through the families and communities? Can we do a better job making sure people have like psychological first aid so they understand that when it might need to go to a different level? So it's just another thing that causes us to have more questions in order to understand how we can be more responsive to the needs of folks. And I just have one more to share. So if we go to the next slide. I just also wanted to bring this up as well, because also to bring up this specific piece that was brought up by the Trevor Project in terms of AAPI LGBTQIA youth, that 40% of AAPI youth have considered suicide in the past year. So this report was out, I think it was 2021. And that when we're looking at the different groups, that it is still, even with like who have seriously considered and attempted. So the number of attempted suicide is lower, but number of AAPI youth, and it's disaggregated by the different ethnic groups, which is Hawaiian, Pacific Island, Pacific Islander, Hawaiian, Chinese, Filipino, Indian, Korean, and Vietnamese, that it's still a serious thing that we need to understand, need to make more visible, need to make more talking in the community about youth that may, even within their community, feel like they cannot share. So the ones who are able to be open about it find it like a strong facilitator and having supports in the community, but the ones who feel that they cannot be as open as to who they are within their family or community may have the higher rates of suicide. Thank you.
I was also going to mention some other, those were great statistics, by the way. It was neat to see, you know, very specific ones about Asian American Pacific Islander. So thank you for sharing those. There are many challenges for BIPOC communities, for immigrants, language barriers, a potential risk of deportation or worrying about being deported if they try to access mental health care, or family separation could also be something they worry about. Access to care, another huge issue. Do I have the transportation to go see my therapist? Do I have childcare? Can I miss work? These are all very legitimate concerns for many people. And many people in minority communities lack insurance. That's another big thing. As many of all of us have probably experienced, even if a provider takes insurance, well, many of them don't, for starters, but they also, and that's due largely to low reimbursement rates. So even if we have insurance, many of the providers don't take them. Their minority communities are also at risk for higher risk for chronic diseases like diabetes and heart disease. A person's physical health can definitely impact their mental health, and vice versa. So a person with chronic pain or disease, that can definitely lead to them developing depression and anxiety, trying to cope with those chronic illnesses. People with disabilities, another good example of people who have unique challenges. They often experience depression and anxiety due to their painful treatments, and really also the isolation that can result from that, from not being able to do the things that friends and peers can do. They may find themselves very isolated sometimes, and that can certainly exacerbate depression and anxiety. A lack of integrated care, particularly in rural and underserved communities. So many health practices in those rural areas are not able to, they either don't have the capacity to work with providers from other specialties to coordinate a patient's care, to be able to incorporate their physical health care and their mental health care together, which really is the goal. And that's often overlooked or not possible in rural areas. And as Razia mentioned, the LGBTQ communities are hit harder. I read a statistic, just 38% of LGBTQ young people identified their home as an LGBTQ affirming space. And as we mentioned, the suicide rates are much higher, and mental health conditions, the risks for mental health conditions are higher. And that's not because of the gender identity question. It's more because if a person doesn't have a strong support system in their home, they are at a much higher risk for developing mental health conditions or experiencing suicide ideation. So, I mean, I think the cultural differences too can certainly influence what treatments, coping mechanisms, and support work that each of us need. So I think really we're talking here about culturally appropriated care and the need for it for these communities, so that everyone can feel validated and understood.
So some of the challenges I think of: stigma, access to quality care, racism and discrimination, surviving violence, and not just sexual violence, but daily exposure to microaggressions and outright aggressions, and things that are shown in the media where we have a collective response to seeing people harmed just because of the color of their skin. And Denise touched on this earlier, that providers don't reflect the communities they served. So there was a study in 2015, approximately 86% of psychologists were white. Being treated or perceived as less than because of the color of your skin is traumatizing, creating, potentially or increasing the risk of anxiety and other mental health conditions. And Sexual violence. So again, I'm at HopeWorks, we're the county's agency that supports survivors of violence, and we do a lot of prevention work. But sexual violence can have a psychological, emotional, and physical effects on survivors. A lot of survivors are living with depression, post-traumatic stress disorder, dissociative disorders, eating disorders. They're all quite common for survivors. And according to the RAIN, the Rape, Abuse, and Incest National Network, RAIN's saying that every 92 seconds, someone in the United States is sexually assaulted. And again, that can cause negative mental health effects. Racial disparity in mental health care largely stems from access, but negative attitudes. So there's stigma in the general population, but there's an increased stigma in specifically Black communities. Nearly half of Americans still believe it is a sign of weakness, and only 27% have tried therapy. SAMHSA in 2021 estimated that only 39% of Black or African American adults and 25% of Asian adults sought treatment. Historically, health disparities due to racism and discrimination practices have long existed for BIPOC communities. So not just having access, but negative attitudes. Yeah, so thank you.
Yeah, I really appreciate you all sharing this information, because I feel like hearing this data, hearing these statistics allows us to understand really how critical of an issue mental health is for a lot of communities, especially in the years following the beginning of the COVID-19 pandemic. I also love the layers and intersections that were brought in and thinking about how intersections of race, gender, sexuality, socioeconomic status, citizenship status, geographical location. All these factors are really important to think about in how we can work with communities to address mental health challenges in ways that are needed for them. And so that'll kind of bring us to our next question, which is the last question. And thinking about how, going off of what Sandra just mentioned, there is a huge stigma in many of these minority and BIPOC communities around conversations about mental health and in seeking treatment, even though those challenges and struggles are readily recognized. So what are ways that we can all work in the community to help destigmatize mental health conversations, mental health in general, and especially when facing potential cultural nuances, differences in these minority communities? I think hearing actual steps about ways that we can support this work in destigmatizing mental health would be really helpful. Razia, we can start with you.
Thank you. And Marla, if you don't mind going ahead and showing slide 8. I just have a few, because I know my colleagues here on this panel are going to share some other stuff. So I just wanted to share 3 actionable ones. One, in terms of being linguistically and culturally competent materials. Not sure how well you can see it, but I worked with the Sikh American Legal Defense and Education Fund. They received a grant. And one of the things we had to do is we talked about different things that we could explain in terms of mental health. So we use the term anxiety and tension. Tension is something that's often used in the Indian community, like I had tension. And when you ask how that's described, they're really talking about symptoms, whether it's somatic or psychological symptoms of like anxiety and like stress. So what we did is we had some really clean, simple language, like what is anxiety, what are some common symptoms and factors and ways to manage it. And so we worked with them to create it. So we have it in English, and on the other side we have it in Punjabi, because that's the language that many Sikh Americans speak. And so you can see that even the graphics that were chosen were people with browner skin, and we had different things like that. So this was a project, and we brought in people with both the mental health expertise, whether they might be Sikh. I'm not Sikh, I'm Muslim, but we work together because of the mental health aspect. And so there are several of these as models that can be used in terms of how can we create these within the community. So a lot of partnering with community-based organizations, because when I used to do the work with Chai, we'd go out to the mosques. Actually, Chai created a number of pieces, one-pagers, simple, psycho educational kind of language, really drilling down to what's the essence of it. What are some things that could be possible ties that is familiar with the community? And let's make sure we get culturally and linguistically translated materials. So it takes work. I want to say that it takes work, because then you need reviews to make sure that when we're translating things, it's not just a translation word for word. It has to make sense in the linguistic context. For example, one time we were trying to talk about schizophrenia and hallucinations, and there was no word that was easily translatable for hallucination. So the person who did it said something like, it's like a dream, which isn't quite accurate. So what we had to do is also make sure that someone who's also familiar with the language, especially if someone who's just not familiar, doesn't have the context in English for it, can explain it in other ways. So that's something else to think about. Not only culturally competent, but linguistically competent information is an actionable step. And I will say it takes work. It takes several people coming to the table. And if it's important, we can get it done. There's funding. We were able to get it through the Asian American Foundation to work on this project. And so we need to advocate for more funding for these things. We need to work with community-based organizations who bring in that perspective, and we need to work with the mental health community to make sure that it's a quality material as well. If we can go to the next one. Actionable first steps like mental health first aid training. I think that I think it was out of University of Maryland. They were actually doing one. It was part of the research, but they were doing it I believe in Vietnamese and also in Hindi. So I think that oh, sorry, if we can go to the next slide. Oh, it is up, sorry. No, sorry, go back to the other one. I messed up. Training people who are trusted in the community. Mental health first aid, hold the trainings in the community, like in places of worship, and partner with mental health professionals in the community. I think that's another really solid actionable step, because it's really good material. Let's make sure we're working with folks. And the other one, last one is holistic approaches to mental health. So, these are questions to ask, like how does the community support mental health in one being? How are we incorporating beliefs into the approach for mental health? Let's simplify the language, right? Like we know, like we can really get a lot of information in there, but let's simplify it to make sure people can understand it, and maybe use pieces that may have metaphors or allegories within the community. Work with religious and community leaders, spiritual and physical components of how we approach it holistically, and using even things like the wellness wheel was a really great way that people were able to kind of pinpoint aspects of their life where they were approaching mental health, not just mental health, but spiritual health, financial health, all these pieces in a way. So those were some practical, actionable steps in the work that I did out in the community that seemed to be that resonated with folks.
Thanks for sharing those. You mentioned translating materials. And so NAMI Howard County is part of a national organization. And I know that at our national level, they are working to translate a lot of our material, our class materials, to try to teach some of these classes in different languages. It's a very large organization, and it's a very Herculean effort, as you know, Razia. So we're also trying to do our part at the national level, and some of those, like we do have some in Spanish. I think they're working on a Korean translation, a Mandarin translation. So we're getting there slowly. But that's definitely a great one actionable step. And I like the mention of mental health first aid training, really important training. And they do a lot of it in our county. The health department does, the hospital does. Most of it's free if you either live or work in Howard County. A couple other things. I would say probably the biggest thing that we can all do is show compassion and try to understand the experience of other individuals with different identities and backgrounds. They're different than ours, and that's okay. And just trying to take a few minutes and really listen to someone who may be sharing that about themselves. But just being patient and understanding, I think, goes a long way. I would also say to try to understand that there's no one size fits all to mental health care. It goes along with all of this, to try to recognize that everyone comes from different circumstances and may have different needs. And as I mentioned before, we really just all want to be heard and know that there's someone out there who understands us. We want some other things, support advocacy efforts to increase reimbursement rates. That's talking with our state and federal legislators, our local legislators, to increase reimbursement rates for mental health providers. So hopefully more of them will take insurance. It becomes more affordable for everybody. And also one other thing I thought of is to support providing financial incentives to minority students who want to go into the mental health field. We're desperate for mental health workers in general, but particularly in these communities, as we've been talking. I would say get the word out that there's help out there. NAMI, for instance, we provide education classes and support groups for free for any adult individual and parent, caregiver, family member who may have someone who's struggling with mental illness. We're there to support families. We're really there kind of after the crisis is over, where that education part to help people understand mental illness. We also do a lot of outreach in the communities, or in our community, with different programs helping people to understand and raise awareness. And I also try to encourage people to check in on family, friends, neighbors, anyone you think might be at risk that just could maybe use a "how you doing today?" and really listen and just try to be there for people. And I know we're all busy, but even just a "how are you doing today" really can help people feel validated and to maybe help them feel a little bit better. And the pandemic certainly has exacerbated a lot of this. One of the stats I saw that I just want to mention real quick before turning it over to Sandra was that when talking about children and the effects of the pandemic, 230,000 American children lost a parent or caregiver in our country during the pandemic. And the loss for Black and Hispanic children was nearly twice the rate of white children. This has really resulted in a pretty substantial increase in health-related ER visits from children ages 12 to 17. Girls, LGBT youth, and children from BIPOC communities were hit the hardest. So, it just really underscores that they're just not getting the help that they need. And the effects of the pandemic are ongoing. And we just need to try to be more responsive. And I know the school system is doing a lot. And I think that's really great. We're lucky here. So sorry, Sandra. Your turn.
No. Okay. Thank you. And and thanks. You brought it up again about the racial health disparities and the reasons behind more people of color dying from COVID and having long-term complications. I would say one of the things we can do is become advocates. So talk about mental health, share your own experiences, and then challenge stereotypes and disparaging comments you might hear in the community. So be an advocate for folks living with mental illnesses. Hope Works, we have a number of programs here to help. So we have a survivor support group for Black women called Loved. And so it's addressing the triple jeopardy. So you're Black, you're a woman, you've been violated. So it's a place where Black women can speak openly and safely. We have our new Survivors Health Project, which is peer-led educational and wellness programs, and that are based on trauma-informed peer support. We have free yoga every Thursday for survivors online through 3.5 Acres Yoga. We have a new program that's going to start in October called Thriving Together. It is a survivors mental health awareness and well-being group. So the inaugural meeting is in October during Domestic Violence Awareness Month. As Denise mentioned, the training for family members, I have personally participated in. It was so eye-opening. I've even been a board member of NAMI and learned more than I ever, for years, where it's like, oh, I hadn't thought about that. It's so educational participating in those programs. And then both of my co-panelists have mentioned the mental health first aid workshops. That is also something you can do to advocate for others. So there's the mental health first aid training for youth and adults. And I would definitely recommend that for community members. Thank you.
Yeah, thank you all so much for sharing. Because I think sometimes we can give as much information as we can about the data and statistics behind mental health. But from hearing those things, oftentimes people are wondering, what can I do to support the efforts toward destigmatizing these conversations, or even assisting people in getting the support resources that they need? I love that some of your responses were as simple as just get the word out. There are resources in our community, so ensuring that people know about them is a good step. I think engaging in advocacy is a great one as well. And I think one of my biggest takeaways is actually something that Denise mentioned, which is holding compassion for others. I think here at the Office of Human Rights and Equity, one of the biggest things that we always want to talk about is honoring the humanity of the people around us and the people in our community. And I think it all comes back to that. And if we're able to just take a step back and listen to the experiences of others and even open up and share our own experiences, I think that can go a long, long way. So I really, really appreciate you all for sharing that information. And so I do want to open it up and just ask for you all to share some final words to kind of round out today's panel. And so this time we can actually start with Denise, if you wouldn't mind.
Well, boy, I feel like I've said a lot. So I think it's really important that the Office of Human Rights and Equity did this panel, because I think for a lot of people, like I said before, we definitely have a mental health crisis in this country, in general, with youth, with adults of every race and religion and everything. But there's no secret that that minority communities are definitely underserved in this area. I mean, I think it was the 82% statistic you said, Sandra, that 82% of therapists are white. I mean, and just looking around, we know that not 82% of this world is white. So, there really is a need for more culturally and linguistic competent therapists out there. And that's, something that I think it's going to take a while to build up, but it's so important. So I wanted to also just mention our website, and since I mentioned these classes and support groups, we're going to be having some of our classes. We're going to be registering for our fall classes very shortly. So it's namihowardcounty.org is our website. So we have a ton of information on there. There's an email address you can reach out if you have any questions, comments, or need some clarification on anything that I said. But I really just want to again say thank you, Holly, and to the office and Sandra and Razia for joining me today. This has been really, really helpful and informative.
Thank you. So my final thoughts, definitely show up for yourself and others. Just show up for yourself and others. Don't worry about what other people are saying. And at least that's my philosophy. What other people think of me is none of my business. So I just, I'm going to be an advocate. Practice self-care. That is so critical. Talk about mental health bravely. Don't be ashamed. Don't add on to the stigma by internalizing it. And then I'll share a quick personal story from way back. I think we are constantly being met with not just microaggressions, but other types of racial aggression. And I think how things they've changed a little bit, but not really. All the way back to second grade, when busing became the law here in Maryland, and I was in second grade, so I was a tiny little kid, and these families were protesting that they didn't want us coming into their, it was all white community that, we were bused into. They didn't want us there. And all I could think was, well, we don't want to be here either. But that was the first time I had been called horrible racist names. And I'm still talking about it. So clearly that caused some trauma. But, people are living with things every day. So, it's important to get help. It's important to talk to people, and take care of our community. Thank you.
Thank you. It's very powerful what you said, Sandra. So I just want to recognize it was very powerful what you said. And I think there's a lot of healing that needs to take place, not just on the interpersonal, but as a community and societal level. And so when I think of that, I think of ways that we can collectively heal. And I think sometimes recognizing that past harms still affect us today, right? And so not trying to minimize when people bring it up, really being in that space as Denise said, in empathy and in compassion, and even saying, no, how are you? I sometimes follow up as, how are you doing with, no, how are you really doing? And really pausing and looking and trying to see the person before me. I think we're trying to, like in the schools, we're doing more with like trauma informed and how we're approaching the classroom, but we have to also look at it from the historical and racial context, because as we said, these things are coming. So is there a chronic condition of trauma that people are experiencing that is not only with the like the adverse childhood experiences, but it's because of the society that we live in? And so these are some things that we have to understand how it impacts, because your body takes you right back to it, right? It takes you right back to that fear, that anger, all these pieces, and your body will immediately do that. So how do we create spaces for people to heal? I think like talking, communicating. I don't think it only has to be done in a therapeutic setting. I think it can be done in communities that are willing to be able to hold space, care, love, and concern for one another, and really open up that opportunity for healing. And I think the collective healing can be so powerful. The other thing is, as you all were talking about advocacy and some of these pieces, I think like, advocating for more reimbursement for therapists is good, but I also think like finding other models in which like therapists can work more directly with people, so they can, make fee structures that they can still get paid, but it's not like a reimbursable rate that's so high that because their reimbursement is low. So personally, I don't accept insurance, but I also work out what people can pay. Like, especially with going to like being able to do it virtually, right, has been another opportunity. And so I think other ways that we can do it, and as mental health professionals, working to do that in different ways can also be like reimagining, right? I think like the reimagining, does it always have to be a 50-minute model? Just because there are other models that'll work. Um, I think those are some ways that as we are working towards supporting each other towards healing, then I think we can find other ways to do that as well. So I always like to be innovative and think like, what's another way we could do this? So that's like my piece. But I just have, thank you so much. I've learned so much being on this panel with my colleagues here.
Yeah, and I definitely want to say thank you to all three of you for your time today and for sharing all this really important information in this really great discussion, because I do think this is an important conversation that really needs to continue. And I definitely hope that the information shared today has been helpful for everyone listening in. And I do want to mention that if the Howard County Office of Human Rights and Equity can support you in any way, please don't hesitate to reach out to us by visiting our website and filling out an online form. Calling our office at 410-313-6430, or emailing us at ohre@howardcountymd.gov. We at the Office of Human Rights and Equity, folks at NAMI Howard County, folks at Hope Works, folks in the school system, we are all here to support the community in the ways that you need. Okay, so thank you all so much, and I hope you all have a great rest of your days.